Hi everyone, so we are dealing with GI pathology. Okay, so now we will discuss about gastric tumors. So first of all, let's see a few risk factors for gastric tumors. Of course, there will be infection can happen, that is infection of H. pylori. Then apart from that, it can be diet. Then it can be intestinal metaplasia, or it can be hereditary non-polyposis colon cancer HNP CC. So among this, which is the most important risk factor? Diet is the most important risk factor. Okay. Now we will deal with gastric cancer. So gastric cancer, it can be two types. I am saying based on the histology, it can be two types. One is intestinal, another one is diffuse. So I think from the name itself you may have understood what is the which is having poorer prognosis. The name itself diffuse, so it is having the poor prognosis is for this one. Poor prognosis. Okay. Now in intestinal, the cells are actually cohesive. Though they are neoplastic intestinal glands, they are expanding sheet pattern, means there is cohesion of cells will be present. But in diffuse type, as the name says, it is already spread. So it will be very poorly differentiated non-cohesive cells, and they do not forming any glands and all. The other one, the name is intestinal because they are actually a type of neoplastic intestinal glands, which are actually very much staying close to each other, cohesive cells. But diffuse, they are spread, poorly differentiated, they are not glandular cells and all, they are just poorly differentiated non-cohesive cells. They are diffusely arranged, and when you look at each cell, they are having a signet ring appearance, like there will be mucin inside that, so that will push the nucleus to periphery, and that is why it is having this appearance of signet ring. So this is associated with which mutation? E-cadherin mutation. Where else you can see this E-cadherin mutation? In breast carcinoma. Which type? Lobular type of breast carcinoma you can see like E-cadherin mutation. Okay. So this is actually the histological classification, and there is a name for this classification called Lawrence histological classification. Now I would like to say about the gross classification. So when you look at an ulcer, what can be it looks like? Either it can be like this or flat or like this. So the first one, it is the excavated. Next one, it is flat. The other one, which is protruding, that is exophytic. Now tell me which is having the poor prognosis. So poor prognosis is for this one, flat. So maybe we get confused now, isn't it? So why the flat one is having the poor prognosis? Because since it is flat, it will be detected late. So by the time we find, it will be already spread very much. Okay. So this is having poor prognosis. So histologically, it will be related to this one. Which one? The signet ring cell type. Histologically, when you look here, you can see the signet ring cells, because that is having the poorer prognosis in histological classification. So that will be present here. Okay. So in the gross, which one is having poor prognosis? Flat. In the histological, which is having poor prognosis? Diffuse. Okay. So diffuse, they are actually they are not forming any glands. Once again, I would like to clear that point. They are not forming any glands. They are just diffusely arranged, very non-cohesive cells, poorly differentiated cells, but though they have mucin in them. Okay, that is giving rise to signet ring appearance. Maybe sometimes you may get confused, like they are having mucin, so are they some glandular? No, they are not forming any glands. though they have mucin in them, that's giving rise to signet ring appearance. Okay, so that is about gastric tumor. So the most important risk factor is diet. All right, thank you so much.